Hey guys, my name is Dr. Scott Mitchell with Limitless Chiropractic here in Austin, Texas. And today I'm here to talk about cranial facial release, a complete guide to understand what this technique is, how it works, how it helps, all that type of stuff. So, cranial facial release is an advanced, non-invasive endonasal cranial adjusting technique offered at Limitless Chiropractic in Austin, Texas. Utilized by trained chiropractic professionals, CFR mobilizes the bones of the skull and face using a brief balloon-assisted method inside the nasal passages. Proponents suggest that this subtle approach may unlock cranial fixations, enhance nasal breathing, optimize the flow of cerebrospinal fluid, increase oxygen intake, provide or improve sleep quality, and potentially reduce dependence on medication or surgery for selected neurological and structural disorders. The fundamental role of nasal breathing in health cannot be overstated. Nasal passages are designed to filter warm and humidify incoming air, providing essential immune defense and contributing to efficient gas exchange. Nasal breathing also regulates nitric oxide production, supports efficient diaphragm use, and is associated with better autonomic nervous system function. Chronic mouth breathing and persistent nasal obstruction can undermine these advantages, affecting everything from immunity and blood pressure to facial growth and sleep quality. This comprehensive review provides an in-depth look at CFR. Covered topics include the definition and mechanistic rationale of CFR, clinical indications, a detailed procedural overview, comparative analysis against conventional therapies, guidance for patient selection, outcome expectations, and what to know about choosing a qualified provider. What is cranial facial release? Cranial facial release is a specialized endonasal technique in which a small lubricated medical balloon is inserted into the nasal passages and briefly inflated. The goal is to induce micro movements in the cranial bones, especially the sphenoid bone, unlocking restrictions and restoring what practitioners refer to as normal cranial respiratory motion. The method grew out of early work by osteopaths and chiropractors who noticed connections between facial structure, breathing, and head pain. As practitioners watched patients, they noticed the very slight movements in the bones made breathing easier. People appreciate CFR since it doesn't require cutting, stitching, or major recovery. You don't have to start taking a new medicine or worry about the effects of surgery, which makes CFR a good choice for those with chronic nasal and sinus problems. Common conditions that respond favorably to CFR. Sleep apnea. Particularly in mild to moderate cases with significant nasal obstruction, these conditions respond favorably to CFR through enhanced airway patency and support for better sleep quality. Chronic nasal congestion and sinusitis. These conditions respond favorably to CFR as the technique assists in opening up nasal passages and improving sinus drainage, which can reduce reliance on decongestants and provide additional relief beyond standard pharmacologic options. Deviate septums. While severe cases may still require surgical intervention, minor septal deviations often respond favorably to CFR by optimizing surrounded cranial facial function and attenuating related symptoms. Snoring. These conditions respond favorably to CFR by improving nasal airflow and reducing vibratory airway resistance, which contribute to snoring. Post-surgical recovery. Patients recovering from nasal or sinus procedures may find that these conditions respond favorably to CFR through enhanced fluid drainage and support for tissue recovery. TMJ disorders. These conditions respond favorably to CFR when cranial bone alignment is optimized, which can indirectly improve TMJ function and reduce associated discomfort. Please note that a comprehensive clinical assessment is necessary to determine suitability for CFR, as outlined in the following sections. The CFR procedure, what to expect. The CFR procedure follows a clear stepwise protocol. First, the initial assessment. The practitioner reviews medical history, conducts physical and cranial assessment, and discusses indications, contraindications, and treatment expectations. Preparation. Patients are positioned supine, laying on your back. A lubricated balloon or finger caught type is positioned into the nasopharynx, which is the region where air travels through during nasal breathing. Breath holding. Patients are instructed to take and hold a deep breath. Brief inflation. The balloon is inflated for approximately 1 to 3 seconds, creating transient pressure. This may be accompanied by sensations of intense facial pressure and audible or tactile cracking of the sutures as the sutures release. Deflation and removal. The balloon is quickly deflated and withdrawn. Repetition. The protocol is repeated for all relevant concha locations in a series of 4 sessions, typically over 10 days. Post-procedure. Patients may receive adjunctive cranial manual adjusting protocols. A single session may last approximately 15 minutes, with the series as a whole completed within 2 weeks. Additional series may be offered for persistent or complex conditions. What patients can expect before, during, and after treatment. During the balloon inflation phase, most patients report abrupt but brief facial and head pressure, sometimes described similar to forceful water entry during swimming. While rarely painful, strong sensations are normal. Auditory or proprioceptive popping may be noticed. Side effects are generally mild and transient, most commonly including minor nosebleeds, nasal or gum soreness, throat irritation, mild headache, increasing drainage, and short-lived fatigue, typically resolved within hours. Patients are often able to resume daily activities almost immediately. Initial improvements in nasal airflow and reduced facial tension may be noted after the first session, with more robust effects appearing after the completed 4-session protocol. For most, outcomes are stable, though maintenance visits may be scheduled as needed. Benefits of CFR. The CFR provides a conservative drug-free pathway to addressing chronic nasal obstruction by optimizing natural anatomical function. Many patients observe increased airflow, reduced sleep fragmentation, and improved quality of life without surgery or chronic medication. Additional benefits may include reduction in use of decongestants, decreased jaw tension, and better concentration due to improved sleep. Patients interested in predictable, non-invasive interventions are encouraged to schedule a consultation. Limitless Chiropractic emphasizes outcome measurements and practical strategies as part of its commitment to patient progress. CFR versus other treatment options. Surgical interventions like septoplasty, turbinate reduction, etc. These directly alter anatomical defects and may be required for several or refractory obstruction. However, these surgeries are invasive, carry procedural risks, require anesthesia, and entail longer recovery periods. CPAP therapy. The gold standard for moderate to severe sleep apnea, CPAP manages upper airway patency mechanically, but does not address root anatomical restrictions. Some individuals experience discomfort, poor fit, or non-compliance, especially with primarily nasal obstruction. CFR offers a lower risk profile, outpatient convenience, minimal to no recovery time, and an anatomical approach. However, it is less likely effective for severe or fixed structural deformities and should not be considered a universal substitute for indicated surgery or CPAP in severe sleep apnea. Will CFR work for you? CFR may be considered for patients with chronic nasal obstruction, sleep disordered breathing, recurring sinus issues, or TMJ symptoms who desire a non-pharmaceutical, non-surgical approach or option and have been evaluated by a qualified provider. Suitability is determined by comprehensive history, exam findings, and exclusion of contraindications. A detailed review of symptoms, medical history, and previous care is performed for every visit and for every referral. Limitless Chiropractic prioritizes patient autonomy and makes informed consent and shared decision-making central to every care plan. Choosing the right CFR practitioner. Look for someone who is well-trained, open to your questions, and able to show their background in CFR. Ask how often they perform this work, what kind of results patients report, and whether they keep up with the latest safety practices. Check reviews or ask for referrals from friends and family. It's important that you feel comfortable with your provider and satisfied they have your health in mind. Dr. Scott Mitchell, myself, with a background in medical biology and a doctorate in chiropractic, provides transparent communication, direct patient education, and high accountability through every interaction. All Limitless Chiropractic staff are experienced in coordinating, scheduling, recording, and referral communication for seamless patient experience. What to expect after CFR treatment. After treatment, the nose may feel a little sore or stuffy, but this feeling goes away very quickly in most cases. Breathing usually improves on several days as the tissue settles. Long-term follow-up and periodic reassessment are encouraged for individuals seeking ongoing benefits. CFR in action, success stories, and patient testimonials. Patients undergoing CFR at Limitless Chiropractic frequently report improved nasal breathing, quieter sleep environments, less reliance on medication, and more sustained daytime focus. Some describe measurable decreases in snoring, while others highlight relief from long-standing jaw pain or sinus pressure. Some frequently asked questions. How many CFR sessions are typically required? Most protocols involve an initial series of 4 sessions within 1 to 2 weeks, 10 days, with additional series individualized based on symptom reoccurrence and chronicity. Is CFR safe for children or elderly individuals? With appropriate screening and practitioner experience, CFR has been performed across a wide range of different ages. However, cautious evaluation of contraindications is essential. Can CFR help in cases of deviated septum or nasal polyps? Mild septal deviation may experience symptomatic improvement, and presence of significant polyps generally contraindicates CFR. How soon are results observed? Initial relief and airflow may follow the first treatment, with optimal outcomes expected after a completed series. So be sure to choose Limitless Chiropractic for CFR. CFR at Limitless Chiropractic represents a clinical supervised drug-free option of chronic nasal obstruction, jaw tension, and select sleep disturbances in Austin, Texas. The clinic's process emphasizes clear assessment, measurable results, and informed patient choice for individuals who value direct evidence-based care. A consultation may be scheduled through web, phone, or in person. So I hope this answers a lot of your questions about CFR. If you have any questions, please let us know.